You have a hole in your skull, on purpose. Someone is scraping away at your bone with a sharpened piece of flint, layer by layer, while you sit upright and conscious. There is no anesthesia. There is no antiseptic. There is only the person holding the blade, and the belief, correct or not, that opening your head will save your life. This isn't a horror story. This is Tuesday, roughly 7,000 years ago, somewhere in Neolithic Europe. And here's the part that should genuinely unsettle you. You might survive it. Not might, as in a coin flip. Might, as in statistically better odds than you'd expect from a surgery performed with a rock, before germ theory, before anesthesia, before anyone on Earth understood what a bacterium was. So, the question isn't just, did ancient humans do surgery? Obviously they did. The real question is how they got away with it. How a species with no microscopes and no formal medical training managed to cut into living human bodies, and, often enough, watch those bodies heal. Let's start with the obvious question nobody asks. How do we even know ancient surgery happened at all? The answer is bone. Bone remembers. When a surgeon cuts into living bone and the patient survives, the edges of that wound don't stay sharp and raw. They round off. They smooth over. New tissue grows across the opening, slowly, over weeks and months, leaving a telltale ring of healed material around the hole. Archaeologists can look at a skull thousands of years after the fact and tell not only that someone cut into it, but whether the person lived afterward and roughly how long they survived. Dead men's bones don't heal. Living men's bones do. That single biological fact is how we know this wasn't guesswork or myth. It's how we know it worked. Trephination, sometimes called trephination, is the name for this procedure, and by a wide margin, it's the oldest surgical procedure ever documented. Not the oldest medicine, the oldest surgery. Archaeologists have found evidence of it on every inhabited continent, created by cultures that had no contact with each other, separated by oceans and thousands of years. Neolithic France, Bronze Age China, pre-Columbian Peru, and Iron Age Britain. Different people, different centuries, different continents, all independently arriving at the same terrifying solution. If something is wrong inside the head, cut a hole and let it out. And they didn't do it once. Archaeologists have recovered thousands of these skulls worldwide. In Peru alone, researchers have catalogued more than 800 of them, some from a single ancient culture. That's not an isolated ritual. That's a medical practice, refined and repeated across generations. Why would anyone do this? The honest answer is we don't fully know, and that should make you a little uneasy. Some specimens show trephination near clear fracture lines, which suggests the surgery was treating real physical trauma, likely head injuries from combat or accidents, relieving pressure from bleeding or swelling on the brain. That part makes clinical sense, even by modern standards. Neurosurgeons still perform a version of this today, called a craniotomy, for exactly the same reason. Relieve pressure, save the brain. Other remains, though, show no injury at all. No fracture, no obvious wound, nothing a modern doctor would flag as a surgical emergency. Which means some of these operations were likely performed for reasons we'd now call spiritual or psychiatric. Seizures, severe headaches, behavior the community couldn't explain. In a world with no concept of neurology, cutting a hole to release whatever unseen force was trapped inside the skull wasn't superstition layered on top of medicine. To them, it was the medicine. Here's the part of this video that nobody expects. For most of the 20th century, historians assumed ancient trephination was almost always fatal. A crude, desperate procedure that killed as often as it cured. Then researchers actually counted the skulls. Anthropologist John Verano spent decades studying these remains from ancient Peru, and what he found broke the assumption completely. Early operations, from the oldest periods, did carry high mortality. Some estimates put early survival as low as 40%. Brutal odds by any measure, but the technique improved. Generation after generation, Andean surgeons refined their methods, and by the time of the Inca Empire, centuries later, survival rates on some skulls reached as high as 80 to 90%. Surgeons had learned, through trial and accumulated observation, which techniques worked and which ones killed. They learned to avoid certain areas of the skull entirely. They learned how deep was too deep. And they learned, essentially without a single textbook, how to operate. And here's the number that should really stop you. Those survival rates, from a Stone Age procedure performed with obsidian blades, are comparable to, and by some measures, better than, the survival rates recorded during battlefield cranial surgery in the American Civil War, nearly 1,000 years later. A war fought with rifles and cannons, documented in written medical records, performed by trained physicians who still had no understanding of infection. The gap wasn't technology. The gap was accumulated skill, passed down and refined, generation after generation, by people history barely remembers. It wasn't just the brain. Ancient surgeons operated well beyond the skull, and the evidence for that survives in writing, not just in bone. Around 1600 BCE in ancient Egypt, someone compiled what's now called the Edwin Smith Papyrus, a document that reads less like a spellbook and more like a modern medical chart. Case after case, laid out in the same format. Examination, diagnosis, treatment, prognosis. Egyptian physicians described how to treat wounds, set fractures, close lacerations with sutures, and manage infection with what they had available, including honey, which we now know has genuine antibacterial properties they had no way of explaining. In several cases, the papyrus is remarkably honest too. For the most severe injuries, it simply states there is nothing to be done, not mysticism, not false hope. A clear-eyed acknowledgement of the limits of their own skill, written down 4,000 years ago. Meanwhile, in ancient India, a surgeon named Sushruta was doing something that sounds almost impossible for its time. His writings, compiled roughly 2,500 years ago, describe more than 100 surgical instruments and detail procedures for cataract removal, the setting of complex fractures, and reconstructive surgery on the nose, techniques still referenced in the history of modern plastic surgery. Sushruta didn't have anesthesia as we'd recognize it, but physicians across multiple cultures leaned hard on what nature offered instead: opium, alcohol, mandrake root. In some regions, wine mixed with narcotics to dull the senses just enough to survive the knife. None of it eliminated pain. All of it was better than nothing. So how did they keep patients alive afterward, in a world with no concept of germs? Mostly, they didn't. Infection was the real killer, and it remained the real killer for thousands of years after the surgery itself succeeded, because nobody understood that invisible organisms, not bad air or divine punishment, were what turned a healing wound into a death sentence. Even without that knowledge, though, ancient healers stumbled onto things that worked. Honey, willow bark for pain and fever. Certain molds, applied to wounds long before anyone knew what penicillin was, because someone somewhere noticed it seemed to help and kept using it. This wasn't science in the way we define it now. It was thousands of years of trial and error, distilled slowly into practice, and passed forward because the alternative was watching people die and doing nothing. None of this means ancient surgery was safe. It wasn't. It means something stranger, and honestly, more impressive. That human beings, armed with nothing but sharpened stone, close observation, and generations of accumulated failure, built a working body of surgical knowledge from scratch. No microscopes, no anesthesia as we know it, no understanding of anatomy beyond what they could see with their own eyes. And still, they cut, they healed, they learned, they refined, and they passed it forward. They watched what killed people and avoided it next time. They watched what helped and repeated it. They built instruments out of stone and obsidian precise enough to shave bone in layers. They developed an honest system for knowing when nothing more could be done. And they did all of it centuries, sometimes millennia, before anyone understood why any of it worked. Every time a modern surgeon opens a skull to relieve pressure on a swelling brain, they are, in a very real sense, finishing a job that started in the Stone Age. The tools changed. The understanding changed completely. But the basic, terrifying courage it takes to cut into a living human being in order to save them, that part hasn't changed at all. It just got quieter, cleaner, and a great deal less likely to end in your surgeon holding a rock.